Now, let me tell you something. One of the most dangerous mistakes nursing students make is thinking adverse effects are something you notice after a medication is given. But understand that the NCLEX doesn't test adverse effects that way. The NCLEX tests whether you can recognize early warning signs before a patient crashes. So today I'm going to show you how to catch those dangerous adverse effects and why this skill is crucial for medication safety, prioritization, and next best step questions. All righty, so let's begin. So in nursing school, adverse effects are often taught as long lists. But on the NCLEX, adverse effects are about pattern recognition. The NCLEX is asking, is this normal? Is this an expected finding? Or is this an early sign of something dangerous? So your job as a nurse is to not memorize every side effect. It's to recognize the ones that signal harm is coming. Okay. Now, understand that the NCLEX rarely asks what is an adverse effect of this medication. You'll never see that. Instead, it asks what findings require immediate attention, what assessment findings is most concerning, what patient needs to be seen first, because these questions are really asking you, can you recognize deterioration early? Because the earlier you catch an adverse effect, the safer your patient is. Now, there are three categories of dangerous adverse effects. Some of these, listening to my videos, you've already heard these, but these are the common things that NCLEX tests on. And so when you think of it as three categories. Number one, airway and breathing. So you're looking for respiratory depression, bronchospasm, swelling of tongue or throat. Number two, circulation. You're looking for severe hypotension, bradycardia or tachycardia, bleeding. And then number three, neurologic changes. Patient sudden confusion, decreased level of consciousness, seizures. If an adverse effect affects airway, breathing, circulation, or level of consciousness, it is never benign. It is never normal. Ever, ever normal. So I'm going to talk about high yield, dangerous adverse effects of medication types, right? So we're going to go through the common NCLEX tested medication groups and the dangerous side effects that you need to recognize early. So number one, opioids. The dangerous side effect or adverse effect, respiratory depression. So early warning signs would be respiratory trending downward, increased sedation, decreased responsiveness. And the NCLEX traps you because students tend to focus on pain relief and ignore breathing. And like I said before, if the respiratory rate is less than 12, you're going to need to hold an opioid, regardless of what the family member says at the bedside. Because the NCLEX wants you to think airway and breathing comes before pain, always. Okay? Anticoagulants. The dangerous side effect or adverse effect is bleeding. So early warning signs would be bruising, hematuria, black tarry stools, bleeding gums. Because the trap is students assuming that mild bleeding is expected, and it's not. The NCLEX wants you to think that any unexplained bleeding is concerning. Okay? Cardiac meds. Those are your beta blockers, your calcium channel blockers, your digoxin. The dangerous adverse effect of these medicines would be bradycardia, hypotension, heart block. And you're going to see this in your patient as with their heart rate trending down, dizziness, weakness, syncope. The NCLEX tries to trap students because giving the medication, students want to give a medication because it's ordered. But remember, it's easier to hold a medicine and give it later because once you give it, you can't take it back. So the NCLEX wants you to think, I'm going to assess my patient first. Orders do not override safety. They never will. Okay? Insulin and hypoglycemics. Dangerous adverse effects, hypoglycemia. Early warning signs would be diaphoresis, tremors, confusion, tachycardia. The trap is students wanting to wait until the glucose is critically low. And the NCLEX wants you to think early signs matter and you need to intervene before there's a crisis. So in the ER, I had a patient, had tucked her in the ER, labs drawn. We had her, hooked up, waiting for results to come in and waiting for additional tests. And as I'm talking to her, she just started saying stuff that did not make any sense. And nowhere on our chart said that she was a diabetic. But something told me, hey, she's confused. Why? Pulse ox is on her. O2 sat was fine. She was awake, alert, color was good. I said, well, blood glucose. Took her blood sugar. She was 46. So as I'm running, I'm going to the ER doctor saying, hey, the patient confused. Vital signs had already been taken. You know, uh, blood glucose 46. And so with that, he gave me orders, and we gave the patient a plate of food, and everything was fine. So we gave her Ampli 50, and then we gave her a plate of food. So you have to be able to assess and see those early warning signs. Now, your ACE inhibitors and antibiotics. So the dangerous adverse effect would be angioedema and anaphylaxis. So you'll see in your patient lip or tongue swelling, hoarseness, difficulty swallowing, shortness of breath. The NCLEX wants you to think this is an airway emergency. This is a medical emergency. You need to act immediately and call the rapid response team. Okay? Now, the NCLEX wants you to develop a skill in distinguishing between expected side effects and dangerous adverse effects. So you need to ask yourself, is this mild or worsening? Is this affecting ABCs, so your airway, breathing, circulation, or level of consciousness? Is it trending in the wrong direction? And if the answer is yes to any of these questions, it's dangerous. Okay. So let's do some mini scenarios real quick. So, scenario one, a patient is receiving morphine, becomes increasingly drowsy with a respiratory rate of 10. What's the most concerning finding? Respiratory depression. Hold the medicine, support their airway, pulse ox, oxygen if needed. Scenario two, a patient is on warfarin and reports black, tarry stools. So, what's your most concerning thing? GI bleeding. So, you want to notify the provider and assess bleeding risk. So, you want to get those vital signs, notify the provider, stay with the patient, assess bleeding risk. And scenario three, patients on lisinopril develops lip swelling. Most concerning finding, angioedema. Stop the medicine, initiate emergency response. One thing I always tell my students is this: once you figure out what's wrong with your patient, the nursing interventions never change. New things may develop, but they never change. Okay. So one thing I do want to talk about real quickly before ending this video, a lot of times students miss dangerous adverse effects because they normalize warning signs. They assume side effects are expected. They focus on medication instead of the patient, and they miss early trends. But the NCLEX rewards nurses who notice change early. And that's what you have to realize. And basically, that's it. Catching adverse effects early is one of the most important safety skills a nurse can have. So please download the Pharmacology Safety Mini Workbook at NurseEdScholar.com to identifying dangerous adverse effects with rationale. And please subscribe so you don't miss Lesson 5, which is antidotes and reversal agents. I really want y'all to do well. I really want y'all to study smarter and learn how to test like a pro. Thank you so much for watching Nurse Ed Scholar. Please like, click, and subscribe, and see you next time.